Hey community, we're back, and I'm Brandy B, the community MP.
And I'm Brandy G, the community NP.
And together we
are B&B, the community NPs.
So today we're going to be talking about DVTs during pregnancy, which we've done a series of things or topics related to blood clots. So we're just continuing this little journey through blood clots.
So let's talk about it. Okay, so DVTs are common during pregnancy and postpartum.
Yes.
So pregnancy and giving birth puts you at risk for developing a DVT. Mm-hmm. So 1 out of 1,600 females experience a DVT during their pregnancy, which 1 out of 1,600 is really not a lot, but I think
there's a lot of births every year, so that's quite a bit.
You're right.
Especially when it's something that's serious to where you could die from it.
Yeah, so I guess just having one is a lot.
Yeah.
Okay.
That's one mommy.
You're right.
But yeah, so it's the 7th leading cause of maternal mortality, responsible for 9% of maternal deaths.
Okay.
And, I think it's important that we talk about, complications during pregnancy and maternal deaths because it is very common it's very common in the African American community.
Yes. So what are some of the risk factors?
So being pregnant.
Yes, that's one.
And then
delivering.
Yep.
Delivering your baby can put you at risk for it also.
Mm-hmm.
And if you have a history of like any type of blood disorders, it can put you at a risk for it.
Mm-hmm.
Even people having multiple births.
Yes.
They're at risk for it. Some other things, if you have varicose veins, which sometimes we get because, we gaining weight and stuff like that.
Very common in nurses.
It sure is because we're on our feet all day
long.
Yeah, so varicose veins. An increased BMI of greater than 30, so that consider you as obese. Goes back to us controlling our weight to prevent this from occurring. Mm-hmm. If you are older mom, if you have a baby after the age of 35, it can put you at risk also. And even if you were hospitalized before for more than 3 days, it can put you at risk because you probably was immobile or something like that.
Is that did it specify like hospitalized related to the pregnancy?
No,
or
any hospitalization that you, if you were ever hospitalized for 3 days or more, that can put you at risk for DVTs.
So that puts a lot of people at risk.
Yes.
And then postpartum compared to during pregnancy, a DVT is 2 to 5 times more common during postpartum than actual pregnancy. So it's after you have the baby where your risk goes up even higher.
Yes.
So in the highest time is about 6 weeks postpartum.
6 to 12 weeks.
6 to 12?
6 to 12 weeks were like the highest, like the time where they really see DVTs occur.
Okay.
And that's crazy because you're at home.
Yep.
So you're at home with a new baby, probably nursing your baby, and it can happen. So that's why it's important for you guys to know the signs and the symptoms. So if you start having symptoms, you go into the emergency room.
Immediately.
Yes.
So,
what? Some of the other risk factors. Postpartum.
If you have a C-section, stillbirth, medical comorbidities, like we said, your weight is higher than what it should be. Young gestational age, of course, hypertension, smoking, eclampsia, preeclampsia, postpartum infection, or hemorrhage.
Doing like your procedures or anything like that can put you at risk.
Yeah.
So it's a lot of things that can put you at risk for developing a DVT during pregnancy. So we're going to try to help the people prevent this.
Because we are all about prevention. That is primarily why we do this, is so that you can be informed and so that you know how to prevent things from happening so that you're healthy.
Yes. So what I want to say. So we said pre-eclampsia. So people may not know what that means. So pre-eclampsia is usually when you're pregnant and your blood pressure is high. Your blood pressure is uncontrolled. So we call that pre-eclampsia because it can cause swelling. You may get swelling in your hands and stuff like that. You start to retain fluid. And also eclampsia. Eclampsia is when their pre-eclampsia went to a worse state. Like you may have a seizure or something because your blood pressure is extremely high.
Yeah.
So those things put you at risk. So usually what they do is they make you deliver.
Yeah.
So once you deliver.
In pre-eclampsia, you might get put on bed rest. Yes. But if you go into eclampsia,
they're going to probably take their baby. Yes.
So prevention.
So prevention. Yes.
Yeah. So you want to talk about the Virchow's Triad?
Okay, so what is Virchow's Triad? So it describes the 3 categories of factors that contribute to having a blood clot during pregnancy. So it could be pregnancy or postpartum after you
Right,
have a baby.
yeah.
So it can be venous stasis, endothelial injury, or hypercoagulable
state. Hypercoagulable state.
So it's meant you at increased risk for developing a blood clot. That's
Right.
basically.
Yeah.
Your blood is flowing sluggish. You may have injury to the linings of your vessels, and you clot faster. You clot easier.
Yeah.
So that's what puts you at risk for developing a blood clot.
Yeah, and you know, pregnancy is really common, and giving birth is really common, and so we don't think about like all the things that go on, but it is pretty invasive. I mean, you're at an increased risk of a lot of things happening during pregnancy.
Yes, you are.
That's a huge procedure. So, shouts out to all you women having babies, because you are the real MVP.
Yes, yes.
But signs and symptoms.
Some of the signs and symptoms of DVTs, which
So-
we told you once before, but we're going to repeat them.
Yeah. Leg swelling can be one leg or both legs. Warmth around that area. Pain usually occurs in the calf, or it can be the entire leg.
Yes.
You may see redness. On darker skin, you know, our skin doesn't really look red, but it may be discolored.
Yes.
And it'll be warm to touch. So you can compare the temperatures from one leg to the other. If it's warm, go get seen. And then what else?
So one of the things in pregnant women that you notice that they may have pain in the pelvic area or the upper part of the leg, which can cause, you may see some abdominal pain, you may see like pain in your butt area, or even back pain.
Yeah. So that's more common during pregnancy because it doesn't, you know, those symptoms aren't as common when you're not pregnant, but you don't have to be pregnant to develop a DVT. So, yeah, know the symptoms.
Yes.
So, and another thing that can happen during pregnancy, or usually it's after you deliver, but it's called DIC, disseminated intravascular coagulation. So that's excessive clotting. So you're kind of throwing clots all over your body. And since we were talking about blood clots, we just thought we'd toss this in.
Yes.
Because it is a medical crisis. If it happens, it's very likely that you're going to die. But
we don't want that to happen.
We don't. So that's why we teach you guys to be healthy as possible, especially when you're pregnant. Like, exercise still, eat healthy. I know them babies be making you like want to eat the weirdest things, but you know, just keep exercising and being healthy.
So how do we prevent this from occurring? We're going to prevent it by knowing the signs and symptoms. And if you see any of those signs and symptoms, you're going to go and get assistance. You're going to go get help, okay?
Immediately. Don't wait on anybody to come home. Just take the baby with you, I guess. Because it is a medical emergency. Call 911. And let them rock the baby while you get treatment. That's how serious it is.
And even if your provider thinks you're at risk, they're going to take some precautions. They may have you walk more. They may give you mechanical devices to put on your legs to try to prevent blood clots from occurring.
Right.
They may give you medications to help prevent. So even if they know you're at increased risk, it's things that they can do to help prevent it from occurring.
Yes. So whatever they recommend, do it.
Yes, please do.
And then after you have a baby, don't just lay there and...
Yes, get up and move around.
Yeah, get up, move around, walk. Especially because they may not tell you to walk, but because you're so smart and you listen to B&B, the community and Peds, you know, after I have my baby, I need to get up and walk.
Yeah, start moving around. Yeah.
So treatment, of course, however severe the DVT or blood clot is, will determine how you're treated, but you're most likely going to see a vascular surgeon.
Yeah, or your OBGYN vascular, they're going to probably refer you to someone else. Even to like maybe what you call it? Oh my God, the what is fetal maternal? It's the OBGYN doctor who sees mothers who have complications during pregnancy. I can't think of the name of it, but I think it's fetal maternal.
I have no idea.
Yeah. I can't think of the name of it, but they have the doctor that just does that. Like any
so
type
you
of
might go see them.
Any type of complication you have during pregnancy, you won't probably see your regular OBGYN and refer you to another.
So you get the special specialist.
Yes.
So what's our disclosure?
So our disclosure is that, remember, this information is just shared with you guys to spark a conversation, to give you knowledge. It does not take the place of your primary care provider. Brandy, please tell them It does not take the place of their primary care provider.
It does not take the place of you seeing your primary care provider as often as your primary care provider recommends.
Yes. So, Brandon, tell them what we want them to do.
We want you to like and subscribe to our YouTube channel. Like the videos. Follow us on Facebook and Instagram. Share this information with your family, your friends, whoever you want to share it with. Because our goal is to have, just to reach the community, to educate the community so that you're not sick and you're happy and you're healthy and you have a good quality of life. So, and why do we do this?
Because community is our beauty. That's why.
That's why we do it.
Yes.
So that's all for us. We hope you guys have a great day and we'll see you soon.
Yes, we will.